What are some of the most deadliest diseases, and what is it like to die from them? Again, you know what I'm going to say before you scroll on, hear me out. What I have found is that the more I educate about diseases and death and dying, the less people fear this topic. And the less we fear this topic, the better we're going to live, I think. So hear me out. This week we're going to talk about Alzheimer's dementia. With Alzheimer's dementia, it's actually very difficult to get onto hospice with this disease. And this is one of those diseases that people can come onto hospice and then come off. So the disease progression looks a little more like this, like a stairway versus a steady downward slope. And it's very difficult for the family and for the patient because it's very stretched out. It can be a very long time, and this person continuously changes and changes and changes until you don't know this person anymore. So it's very difficult for the loved ones and for the person obviously experiencing this disease. So what do they look like when they come onto hospice? When they actually get onto hospice, they are usually very debilitated, mostly nonverbal, mostly bedbound, needing max assist for all ADLs, meaning cleaning, changing, feeding, usually having difficulty swallowing, possibly an aspiration pneumonia sometime in the past year, multiple falls, maybe bone breaks. That stuff needs to all be happening until hospice will actually let this person come on to hospice. Which I'm not even saying I agree with that, but that's where we are per Medicare guidelines. So the hardest part of this disease to me is like the length of it, not the actual death part. It's the length of the disease. 10, 15 years of someone slowly deteriorating can do a lot on their loved ones and on that person. The main symptoms I see are confusion, terminal agitation, paranoia, aspiration pneumonia. The best advice I can give for anyone caring for someone with this disease is let them be your guide. Do not force them to do anything. If they are clean, if they're safe, if they're comfortable, you're good. Do not force feed. Do not force them to get up if they don't want to. You have to, of course, keep them safe. You have to, of course, keep them clean and keep them comfortable, but do not force their body to do anything. The more we allow the body to be our guide, the better and more peaceful the person usually dies. What a death with Alzheimer's usually looks like is someone just sleeping literally all the time, 22 to 24 hours a day, and just not eating anymore. And although it feels crazy that we just let someone not eat, usually they have a very, very peaceful death. If they do end up having some terminal agitation, we can definitely medicate for that. Let me know if you have any questions.